Hi, everyone. I'm Marilyn Pierce, Assistant to the Cabinet Secretary for Children's Programs, and I present the Resource Rundown on Tuesdays at noon from the Office of the Cabinet Secretary with the Department of Health and Human Resources. We know that every person's schedule is unique, and not everyone will be able to join us for our live Resource Rundown on Tuesdays at noon. So we wanted to make sure that you have this resource at your fingertips. The Resource Rundown is your introductory guide to services for your child, and we encourage you to please register and join us live when possible. So you will have the ability to submit questions in our question and answer feature, and we can also follow up with answers to your questions. For those who cannot attend live, we will post any questions that we receive on our Kids Thrive website, and that is kidsthrive.wv.gov under the Resource Rundown tab. Now, those questions will be updated weekly as new questions are received from our live sessions. Please keep in mind that this is a broad overview and not child family specific. So if after this session, if you have a question that is specific to your family or situation, I encourage you to please email us at kidsthrive@wv.gov. All right, let's get started. Being a teenager isn't easy. Being an adolescent isn't easy. Parenting isn't easy. And I'm talking about all parents. Birth parents, adoptive parents, kinship parents, foster parents, grandparents, all parents. If you are a resident of West Virginia and have a youth in your care who is 3 to 21 years old, this is for you. Does your child have a mental health diagnosis, or are their behaviors or emotions interfering with home life and school and community activities? Are you worried about your child and just not quite sure where to go or what to do? Are you feeling overwhelmed by your child's behaviors and seeking support or guidance? Or are you really not sure, but you want more information? Well, if any of that sounds familiar, then sit back, relax, take notes, or leave this on in the background while you multitask as you tune in to the Resource Rundown, your guide to accessing help for your child. And then we're going to keep things as uncomplicated and as straightforward as possible. First, it is important that I tell you that the services that I'm going to talk about will not cost you anything out of pocket. That's right, nothing. So please keep that in mind as we continue. So where do you start? If you want to get help for your child, or you just want to find out about available resources in your area, I encourage you to call or text 1-844-HELP-4-WV. That's 1-844-435-7498, or even scan this QR code from your smartphone, or visit help4wv.com/contact. That will take you to the Children's Crisis and Referral Line, and honestly, your step one. Who can call? Anyone. Does that mean you are now involved with CPS or the police? No, this is neither. Think of this as the front door to resources. That brings us to step two. As you're speaking with Help4WV or texting, they may mention things like CSED or Wraparound or Crisis. But what does that mean? Well, first, don't hang up. They're just gathering information to determine your need and identifying if you need assistance right now. Let's start with that. If your in need of immediate assistance, they will offer you Children's Mobile Crisis Response, which is for that immediate ASAP, someone help my child right now situation. Children's Mobile Crisis Response can talk on the phone or meet in person, whichever you prefer. And they can meet anywhere that's helpful to you, even in a Walmart parking lot at 10 p.m. if you need it. Now, does that mean they take your child or our CPS? No. Remember, back to the top, none of this is CPS or the police. Can you refuse services? You sure can. Will a referral be made if you decline services for your child? No. This isn't CPS or law enforcement. Now, if you don't need immediate assistance, then you won't get mobile crisis response. You'll simply continue with your conversation with Help for WV. When speaking to Help for WV, they may mention wraparound. Well, what does wraparound mean? Wraparound is a way of working with the youth and the families by offering community-based services that are intended to wrap around the family, putting and keeping you and your child at the very center. This is designed for you. Help for WV may ask if you'd like to apply for CSED waiver. CSED stands for Children with Serious Emotional Disorder. But don't be alarmed by that title. That's just the name of services, so your child can receive support in your home or community for their mental health, behavioral, or emotional needs. So in other words, CSED is simply part of wraparound. So let's say that you want to start the application process. Well, first, you'll need the basics. You'll need to have your child's Medicaid number and Social Security number handy. Don't have Medicaid? No worries. There is a process in place for that too. Services are available to any child, regardless of insurance, still at no cost to you. Now, much like when completing any paperwork, you have your basic questions that you need to be prepared for, such as confirming your address, your child's information, number of adults in the home and children in the home, and general information about your child. So now that you've got this ball rolling, and if you don't need immediate assistance, remember Children's Mobile Crisis Response, Help for WV will pass along your information to a coordinator. You'll receive a call from a coordinator. We'll call her Sarah the coordinator, who will be your contact person throughout the entire application process. You'll be asked what you are experiencing with your child, how your child does in various settings, such as home, school, and social. And from this point, you're having a conversation where all questions are tailored to your specific situation and each build on the other. Now, these questions are to verify the information in your application and to gather additional information needed. Prior to your call ending, you'll be informed of next steps and when you can expect another call. Coordinator Sarah will tell you what resources are available to you in the meantime and provide you with contact information specific to your county. That's right, no matter what county you live in. Now, don't forget, you'll still have your coordinator's contact information for any questions during the process. So now you've spoken with your coordinator. Remember, we named Sarah. But now what? Well, within 4 business days, you'll receive a call from someone with the CSED program. For the sake of the resource rundown, we will name her Ashley. Now, they may say KeyPro, but that's just their agency. Ashley with CSED will explain who they are and request a time to complete a PECFIS, which is the Preschool and Early Childhood Functional Assessment Scale, or a CAFIS, which is the Child and Adolescent Functional Assessment Scale, depending on your child's age. Now, this is the first evaluation to determine eligibility. And this call will last approximately 40 minutes, and it assesses your child's level of functioning in various settings. Have I mentioned that it's not CPS? None of this is CPS. Once you're done, Ashley will give you a list of independent evaluators, which is just a fancy term for someone to complete a psychological. And you get to choose from that list. A psychological evaluation gathers information about how your child feels, thinks, behaves, and it helps identify the best way to address presenting concerns. You don't want to, not ready to schedule, maybe you need a few days, no worries, you don't have to. But for the sake of the resource rundown, we're going to say that you're ready to schedule. Well, then Ashley will set that up. Now remember your coordinator that we named Sarah. Don't forget, she is still there. I know that you've heard a lot, so I want to summarize to this point. First step is reaching out to help for WV. Your second is receiving that first call with a coordinator who we named Sarah. Your second call is someone with the CSED program who we named Ashley for completing your CAFIS or PECFIS and scheduling your evaluation for your child. Then you'll receive a call from your coordinator again. And after that, you'll be notified via mail of eligibility. Now, don't forget that during all of this entire time, you still have your coordinator to contact with questions, and you can still use the Children's Mobile Crisis Response for immediate assistance. An example might be if you feel that your child is out of control and you want help with that situation. Keep in mind, it's still not CPS. So now, while you wait for eligibility, your coordinator Sarah, is going to provide you with a list of agencies that you get to choose from to start providing wraparound services. Think of this list much like shoe shopping. There are multiple shoe stores and they all sell shoes, but you may have a preference on where you prefer to buy your shoes for whatever reason. You pick the store that is best for you. The same thing applies when choosing an agency. They offer the same services, but you choose whichever one you prefer. What services are offered through Wraparound by these agencies? Well, your first agency you choose will provide your wraparound facilitation. You'll have a wrap facilitator that coordinates the services that are tailored to your family. Remember, it keeps you and your family and child as the focus, as the services completely wrap around you. You make the decisions on what services you want provided, who will provide them, and where they're provided. Which brings us to your second agency for services. Now, when you choose your wraparound service provider, these services include in-home and out-of-home therapy, in-home family support, respite, in-home and out-of-home, specialized therapy, community transition, mobile response, peer parent support, independent living and skill building, individual supported employment, assistive equipment, job development, and non-medical transportation. Next, you will be linked to the agency of your choosing, where you will work together to develop a plan that is specific to your child and family. Again, you are not locked into services. At any point in time, if you are the legal guardian, you have the right to decline or discontinue services whenever you want with no repercussions. If you choose to continue, then these services typically last 6 months to 1 year, depending on your child's needs. After 1 year, your child will be reevaluated. Can you refuse services offered? Again, if you are the legal guardian, you have the right to refuse and/or discontinue services at any time with no repercussions. Now, you might not know what all of this means, and maybe you've never heard of any of these terms mentioned. That's okay. Email us at kidsthrive@wv.gov, and we'll gladly point you in the right direction. Just like when speaking with doctors, lawyers, mechanics, firefighters, coal miners, or even your next door neighbor who is a master video gamer. Sometimes we use terms or lingo that others don't understand or even know what we're talking about. If that's the case, visit us online or email us at Kids Thrive for more information. If you're watching this video on our Kids Thrive website, check out the How Do I tab with more information. If you're hesitant to call Help for WV, don't worry. You can also chat anonymously with someone at Help for WV. You still don't want to? That's okay. You can also get a referral from your primary care provider, school personnel, or your local DHHR. Hi, I understand that that was a lot of information, but please know that this is the general process for most families. And of course, there's always exceptions, as every family and situation are unique. That's why your coordinator is involved. We encourage you to please register for our live sessions on Tuesdays so you can submit any and all questions. When you attend a live session, you'll receive a survey about your experience during the session so you can provide feedback and recommendations for future topics. Survey feedback is greatly appreciated as we continue moving forward with the resource rundown and update this presentation as needed based on feedback received, because sometimes improvements are just necessary. Thank you, everyone, and I hope to see you on Tuesday. Have a wonderful day.